our drug, in comparison with the covalent and non-covalent, is an additional ability to epigenetically reprogram and reset the chromatin state at the promoter level of a BTK, and so affect the transcription, just this. And in comparison, I think that it's an important strategy, because we can prospect that this drug we can use in relapsed and refractory patient, but not only in the patient that develop the mutation, okay, but also just at the second line, also when in the patient develop a higher toxicity, for example, okay, or develop a different mutation, okay, because we act also in a double mechanism at G, at enzymatic level. Just we have this additional point. And in which sense? We act upstream and downstream, okay, on the pathway, on BCR signaling pathway, okay. Another important point that I would like to underline, that because this is an epi drug, okay, we are able to remodeling the chromatin, but we recognize that this alteration, this reprogramming of epigenetic reprogramming is not wide, but very specific in our system, in CLL system, in the B-cell malignancy system, because we affected the transcript and the state of a chromatin in a specific site, a specific region that have an impact in the B-cell malignancy survival and the immune response. Okay, it's not wide, because it's epi drug. We can think that we have a wide effect. No, it's a very peculiar the activity of our drug in this system. Seems that very specific cell type activity, and obviously we can try to hypothesize that this drug can be used when also appear other type of mutation, as previously anticipated. For example, if there are some patient that has a deletion in P53, okay, our drug is also an activity at epigenetic level on the P53, is able to acetylate P53. So also in the patient in which we have or don't have the mutation in P53, our drug is epigenetically act on the P53 and is able to induce the cell death in independent way, in the P53 in independent way.